Hey everyone, welcome back. This is Troy with Ohio Men's Health once again. Hey, if you're looking for us and perhaps you've seen some of our videos, you can find us very simply by searching www.columbuslowt.com. So just go to columbuslowt.com. You can call or text via this number, 330-662-1030. You can also find us on Facebook and YouTube by just simply searching Ohio Men's Health. So today we're going to talk a little bit about estrogen. Estradiol, however you want to pronounce it, estrogen. So a lot of men come in, and the reason I wanted to do this video, this is something I see frequently. A lot of men maybe go to their family doctor and they complain about the symptoms of low testosterone, which we talked about in the last video. So if you missed that one, go back and watch that one, then come back and see this one, but estrogen. So they go see their family doctor like, hey doc, listen, I think my testosterone's low. I'd like you to have you check it, and I'd like to consider being on testosterone. So they see the family doc, and the family doc checks it, and they're like, yeah, looks like the tank's a little bit low. Let's get you started here. So they start on testosterone replacement therapy, and they just kind of go after a month, 3 months, a year, 6 months, whatever. They come in and then they find us and they go, listen, I'm on testosterone replacement, but I don't get it. I'm just not seeing the benefit. Like I hear all these guys going, man, this is like the fountain of youth, and I'm just not seeing the benefit, and the symptom change that I was looking for, and quite frankly, in some regards, it's worse. Well, one of the big things that we need to consider, and this is something that we draw initially and look at, and we need to assess your profile, like what do you have going on? What did your estrogen look like on the initial profile? What's your BMI? How much adipose do we have? There's a lot to consider. But estrogen, if we don't keep an eye on this and estrogen goes high, we tend to see a lot of similar symptoms. We get fluid retention. Maybe we get man boobs, gynecomastia, nipple sensitivity, nipple tenderness. And we just don't see some of the benefit in the way that we feel like we would expect on testosterone replacement therapy. Well, let's talk a little bit about, in just layman's terms, estrogen. Men need it. We need estrogen. It's a hormone that we need. It helps us with a couple different things. Like women, it does help keep our bones strong. So, estrogen in women goes down in their late 40s, early 50s. That's called menopause. So their estrogen just goes off a cliff and it's gone for life. And then they can have more brittle bones. They're more prone to fractures, and that's why women go on calcium and vitamin D and stuff like that to keep their bones strong, and they need to walk and have impact and keep the bones healthy that way. Well, men need estrogen too, and estrogen does help with that. It helps keep our bones strong too, and we need it. So number one, it does do that, but number two, it does drive our libido, and it does assist with quality and stiffness of erections. So what happens is a lot of men will just get on testosterone, whether you get it from Joe Schmo at the gym or some knucklehead on the street, or you bought it online somewhere, or you go to your family doctor and you're just taking testosterone. You go, gosh, I'm just not seeing results, and my libido got worse, and quality of stiffness of erections is terrible, and I feel like I'm just puffy and bloated and retaining fluids. And you probably are if the estrogen gets too high. So estrogen needs to be addressed, it needs to be evaluated, and then there are ways to keep the estrogen at a good level. Most labs will want to see the estrogen level somewhere around 20 to 40. That's kind of quote unquote the sweet spot, is to be right around 20 to 40. And when we manage testosterone levels, and we've got testosterone at a good stable level and estrogen's at a good level, that's where we see you function at your best. Now, where does estrogen come from? So if you think about estrogen, again, in layman's terms, where it comes from, it's a byproduct. So, estrogen is helped and managed by DHEA and testosterone, amongst other things. But to kind of keep it simple, let's just think about it this way. Imagine testosterone is a byproduct of testosterone metabolism, okay? So we'll use this analogy. Put gas in a car, okay? Go drive the car. Out the rear end comes carbon monoxide and other pollutants. So as we utilize gas and we drive the car, the gases burn up, and then outside the back comes this byproduct of these fumes, carbon monoxide and other things. Estrogen's the same way. It's a byproduct of testosterone. And as we utilize testosterone, best way to think about it is if we utilize testosterone, it's going to turn into estrogen. And if we're just getting testosterone and testosterone goes up, in some men, the estrogen goes up with it, and then we get these side effects. And the typical side effects can be again, you might feel a little moody, you might feel just a little depressed, you start crying at radio commercials and Hallmark movies, you just feel a little moody, a little tearful over things. We can truly get gynecomastia, which that's a medical term for breast tenderness, swelling, nipple sensitivity, redness around the breast, man boobs, another name for it. So we can see that a little bit as well. And we need to make sure this is managed. So we use what are called aromatase inhibitors. And there's a couple different medicines that can help us do that. And in a lot of men, that's simply all the fix that's needed, is they're going in and maybe getting a weekly injection from their family doctor, maybe every other week or maybe once a month. And estrogen's just out of balance, and sometimes we need to bring that back into balance. So estrogen is one that we certainly don't want to ignore. We need to consider that. And that's part of our initial lab draw and analysis, is to look at the total testosterone, the free testosterone, and the estrogen amongst 20 to 30 other labs, which we review. It's a very extensive blood draw. So again, best thing to do if you're like, kind of sounds like me, or perhaps you've been interested in testosterone replacement therapy and just haven't pulled the trigger, we'd love to meet with you. We do a true free consultation. Spend an hour with you. We draw blood. There's no cost for that, truly, no cost. There's no bait and switch, nothing. Free consultation. We'll draw your blood. We'll send it to LabCorp. We'll utilize your insurance. It's typically well covered. Bring you back, review, and see what the labs show us. Again, those 2 visits, no cost. And even if you're a candidate for replacement therapy and you decide not to, you don't know what's the thing, we're happy to teach you about it. Now, you can find us. You can find us by looking at online and go to columbuslowt.com, so www.columbuslowt.com. You can call us 330-662-1030. You can also text that number if you have questions. And then, of course, on YouTube and Facebook, most likely that's probably where you found us, is you can just search Ohio Men's Health. We look forward to putting out more information. Thanks for watching today's video. If you're on YouTube, hit the subscribe button. If you're on Facebook, hit the follow button, and we'll see you next time.